There is still a lack of mental health trained nurses. We know that this is happening at the moment. There is a cohort that is being trained at the university, but of course in the meantime there is still a shortage which has an impact on the service.
Let's go through some of those points that are highlighted in the report that you've highlighted yourself. Ocean Views dealing with detox patients, and that's not what it's there for.
That is something that is mentioned in the report on a number of occasions. It's not just the board, the mental health board, that has this opinion, but based also on the opinion of other professionals in the service who think that it is a very risky procedure, and that can be very risky, and that Ocean Views isn't really set up for it. So they do urge the GHA to come up with an alternative solution.
Another thing that I know that the support group has been advocating is full-time accommodation, and that this is expanded.
That's right. This has been supported, this is something we've been campaigning for years now. We believe that there are a number of service users, we're not sure exactly how many, maybe 20 to 30 people at any given time who need full-time support. It's not enough for them to live in the community with the support of carers for some hours a day. We feel that they need to be like the people who are living in sandpits at the moment, or Kent House, and we're very pleased to see that the support has echoed our concerns and believe that this should happen, yes.
If I can just pick you up finally on those changes, you say you have noticed improvements.
Well, I think there are a number of improvements. Generally, the move is towards a much better system, and we see it in many different things, But there are a number of things that come to mind. For example, the better running of the lithium and clozapine clinics, to say something. The fact that now we have an activities coordinator in Ocean Views. So the problem is that person apparently doesn't have a proper job description. Also, the person in charge of the outreach to patients doesn't have a proper job description. The code of practice apparently isn't in yet. But there are a number of moves. The fact that we do have a liaison team that intervenes in crisis. That is a very good thing too. The fact that they don't have enough people, that they don't have a good enough office to work from in St. Bernard's is not a good thing. But we are going to have a new hub, and we're very optimistic about the fact that things are going to work a lot better when everybody's working under the same roof, when everybody can coordinate, and when everything is done in the best way possible.